Hello and welcome to this video on agranulocytosis for medical students. Agranulocytosis is a life-threatening emergency when you have low neutrophil counts as well as low granulocytes. Granulocytes are a type of white blood cell, and our white blood cells are found in the blood and they help fight off infection. But as soon as we have a disturbance in these white cells, or we reduce the amount of white cells in our blood, we will get infection. Our body will not be able to fight against these invading pathogens as well, and that will lead to further infection. Granulocytes are an important part of the immune system and help the body fight infection. A way to remember the granulocytes is a mnemonic BEN. B for basophil, E for eosinophil, and N for neutrophil. So agranulocytosis is a lack of granulocytes. So the granulocytes are lower. The causes of granulocytosis can be drug-induced and after chemotherapy. The 3 C's are the 3 drugs which can induce agranulocytosis. Those 3 C's are actually C for carbamazepine, C for carbimazole, which is an antithyroid medication, and C for clozapine, which is an antipsychotic. When the lab value of neutrophils falls to less than 0.5, you know you've got a problem, okay? And when you have that problem, by the way, it's 0.5 times 10 to the 9. That is when you have a presentation of a patient who has weakness, lethargy, tiredness, fever. They often have symptoms of an infection. The symptoms will be of an infection: tiredness, weakness, fever, and shortness of breath. Now, when agranulocytosis occurs in a patient with a comorbid condition like heart disease or kidney disease, that is when it can lead to severe infection, severe sepsis, and it can be fatal. And this is a real threat. What is the treatment algorithm for agranulocytosis? The treatment algorithm is you need to start the patient on broad-spectrum IV antibiotics as soon as possible. Remember, the longer that the neutrophils stay low, the more dangerous this can become and sinister it can become. So, as we've talked about, a broad-spectrum IV antibiotic is the treatment. The treatment algorithm starts off with giving piperacillin and tazobactam, which are broad-spectrum IV antibiotics. If the patient responds and their neutrophil count rises again and the patient improves, you can then give a GCSF, which is granulocyte colony stimulating factor, to start to try and trigger the production of these granulocytes. However, there's a chance that it does not improve. The neutrophil count does not normalize and their condition does not improve with these broad-spectrum IV antibiotics, in which case we will start the patient on IV antifungals, because there could be a chance that there is a fungal infection underlying as well, and that will target the fungal infection. That is everything you need to know for agranulocytosis. I wasn't able to find a succinct, helpful video actually on YouTube, so I hope this one was helpful for you, and until next time, cheers.